What I'm going to show today is how we take care of ACL and hamstring problems. We reduce the frequency and the severity of ACL injuries, and we basically prevent hamstring injuries altogether. If you take a cable, you allow the cable to go slack, you put a sudden load on it, the cable can snap. If that cable is taut and tight, you put a sudden load on it, it'll hold the load, there won't be any problem. The ACL works in a similar way. The mechanism of the injury for ACL is somebody running, sudden change of direction, sudden stop, the knee is bent. If this is the femur bone sitting on top of the tibia, the knee is bent like this. There's a shear force to slide the femur off, all right? Slide the femur off. The PCL, the big fat ligament in the back of the knee, is supposed to stop that from happening, but if you do it 1,000 times, it's not gonna. So every time that this femur slides forward, you have a slight slackening of the ACL. If you slacken the ACL, stand up, put a load on it, that slack ACL causes instability in the knee, causes weakness in the hamstring. This treatment fixes that. We've got two things then to repair. One, we've got the ACL to bring tight so that the knee is stable and the ACL has less of a chance to suffer injury. Two, we want to restore the best operating strength in the leg that we can. And this is how we go about it. This is Scott Mitchell, well-known wide receiver.
Passing down for Hamilton, great protection up top for Scott Mitchell, and he's got it at the 5.
What we're going to do here, Scott, if you lie on your back, put your head up here, feet down at that end, face up. The first thing we do is we go through and we use basic chiropractic treatment on the spine. Why? Because what we're going to cover later, which is the proprioceptive inhibition, is a systemic wide reaction. So we want to address the entire musculoskeletal system. All right? Scott is 2-3 hours from a game today, and so this is what we propose to treat him for, and this is how we propose to get him ready from our point of view. All right? We come through. I'm going to check and see through his neck and head, make sure that things are where they're supposed to be. A little bit of movement to C5, right in through there. We come through. Scott's in pretty decent shape, not a lot to fix. Fix that. Again, the reason that we're doing, you are in good shape. Lie on this side, please. Again, the reason we're going through is because the muscle weakness, pardon my back, there you go, face up. The muscle weakness that we're going to encounter is caused by something called proprioceptive inhibition. Those of you that want to know more about that, face up, can look at a 2006 publication from Japan authored by Owasa and Ichi, which talks about the ACL hamstring reaction. Okay? We're coming through right now. What we now do, slide Mr. Too Tall up here. What we're going to do is we're going to check the leg abductors. Leg straight. Push out to the side as strong as you can. Ready? Push. All right, now I can move his leg. I should not be able to do that. He should be able to lock these adductors all the way out. Right here. Push out to the side as strong as you can. See, I can move his leg, so I know we've got work we have to do. Again, we come up, we recheck the hip as I fall out the door. That's for the shoulder stability. Remember, we're talking about system-wide proprioception, right? Shoulders. Now we're going to start on the first bones that we stabilize in the ankle, cuboid and talus. The two big bones involved in almost every single ankle injury. Okay, we roll the cuboid down, talus up. Checks knee stability. There should be no lateral movement in the knee. There's lateral movement in both directions. It's slight, but it's there. When I say there should be no lateral movement, that's exactly what I mean. None. Again, cuboid, talus, come up. Check through here. This, some sort of a voodoo thing that comes from Russian bone setting. We use it in because what it seems to do is to stabilize the flexors so that they respond well when we get through with what we're doing. Again, checking, patient lays face down. Flip over, please. What we're going to do now is we're going to check and see whether or not we indeed have what I believe to be hamstring weakness. Hold the leg right there. I'm going to push down, you make it strong and resist. Ready? Resist. Okay? I should now be able to do that. We're talking about a world-class sprinter. Hold it right here. Make it strong. Don't let it move. Ready? Resist. Okay? We're also talking about a professional football player. If I send him out, he feels fine. Doc, I'm ready to play. I'm good. I don't need any help. That's why I never ask. I just have the player lie down. We take them through this protocol. When we get to this point, I check. That muscle should lock out what we conventionally call 5x5. That means that it contracts quickly and it holds the contraction. If the muscle is capable of doing that, it is less likely to be injured in the game. He is not going to be running down the field halfway through the third quarter, already tired, and have all the gas run out of that muscle, have the hamstring go instantly weak. The next step he takes, the thigh flexor pull the hamstring forward, and the hamstring is already spasming, and there is your hamstring strain, your hamstring tear, and he's out for 6 weeks. We don't want that to happen. He's just been working the last 2 years to become a starter. Comes through here, we're going to make this strong. What I do now, this little adjustment right here is the adjustment that we use to pull the ACL tight. Remember, if the ACL is lax, it can get injured. If the ACL is lax, knee instability causes muscle leg weakness. You just saw it. Muscle abductors were weak and the hamstrings were weak. We come over, we do this adjustment again, just like that, just like that. Okay? Now, ostensibly, the ankle is now stable, the knee is now stable, the hip and the spine. All the joints are now stable. Let's get the muscles up. These muscles will not react without having all the joints stable. We come through and we've got the tendons that we want. You can palpate them out. Tendinosis and membranosis primarily. What we're going to do here is we're going to elongate or stretch the insertion and origin sensors, tendon sensors. Then we're going to come up in the muscle spindle. Same thing. Bring it up, make it strong, hold it, don't let it move. Ready, resist, and it locks. Okay, same thing here. Expect that the athlete's going to have a little bit of discomfort when we do this. Bring this up, hold it, make it strong, ready, and resist. Okay, good. The next thing we check, internal rotators. I'm going to pull to the side. You hold this strong, don't let it move. Ready, resist, that's good. I'm going to push to the side, you hold it. Ready, resist, that's good. Face up, please. So now we have spine vertebra, musculoskeletal, stable in place, hip, knee, ankle, stable and in place. Now we're starting to restore the athlete to his full strength. What have we got now? We have less of a chance of having an ACL injury. We have less of a chance of having a hamstring injury. And even if they do, through some freak or some accident, have an injury, the severity of the injury is going to be less. Let's check the abductors. Leg straight, push out to the side as strong as you can. Ready, push. Okay, that's a lock. Ready, push. That's a lock. Okay, the last thing I usually run through in this part of it, even though it's not part of the ACL hamstring, as long as we're here, let's check the ankles. We've got 3 muscles we can work with. Anterior tibialis, bring this up, hold it, make it strong, and push down, ready, and resist. That locks good. Down and in, hold. Posterior tibialis, hold it, don't let it move. Good, locks. Outside peroneus muscles, pushing in, you make it strong, that's good. Bring this up, hold it, make it strong. Good, toe down and in, hold it, make it strong, that's weak. Down and out, hold it, make it strong and push it in, that's good. Okay, so we come up, the one that we found, posterior tibialis. Significance, he's a wide receiver. As he's running a pattern, he's going to cut. Posterior tibialis stabilizes the arch and the outside of the ankle. If it's weak, it's a potential injury. He can't feel it, he can't sense it, but we can find it and fix it before it's a problem. And that's exactly what we're doing right here. So down and in, hold it, I'm pushing, lock it, and that's it. Good. And that's what we're talking about. This is the portion of the protocol that we went over together, guys, which covers the ACL and the hamstring. Got any questions? You can call me, Dr. Henry.